Well, health news now. Couples having trouble getting pregnant often turn to IVF.
Now some women are trying to conceive, then they're opting for something called natural in vitro fertilization. But is it really better? CBS News' Dr. Max Gomez has the results now of a new study. Dr. Max?
That's right, Christine. Natural IVF means retrieving an egg from a woman during her normal cycle without the extra stimulation of fertility drugs. But those drugs means that on average, a woman produces 12 times as many eggs per cycle, improving the odds of getting pregnant. Question is, are the eggs as healthy? Meet 6-month-old baby girl Davis, a very happy and healthy young lady born to mom Laura through in vitro fertilization. Laura turned to IVF after 2 ectopic pregnancies left her with damaged fallopian tubes. Her first IVF attempt was a so-called natural cycle.
I was eager to try the natural study in attempts to have a child as natural as possible.
Many women go the natural route because of the belief that eggs produced with the aid of fertility drugs may be inferior.
They might be more prone to genetic error. They might not work as well. They might implant less often, be less likely to make a healthy baby.
But Laura produced just 1 egg that failed via the natural route. With stimulation,
they retrieved, I believe it was 24 eggs. I don't know if that's, I know it was over 20.
But to determine if those eggs are truly as healthy, Dr. Scott, the clinical and scientific director of RMANJ, did a large study comparing nearly 400 naturally produced egg cycles versus 1,800 similar patients. The babies born either way were just as healthy, but natural IVF cycles had some significant disadvantages.
Far inferior in terms of delivery rates because you get fewer opportunities in each treatment cycle. That costs more money, it wastes time, it's an enormous psychological burden for the patients.
And it was a stimulated cycle that gave Laura the joy of her life.
I never would have wanted this life without her, now that you know what it's like to have her.
Now, it also used to be thought that fertility drugs increase the chance for ovarian cancer, but it turns out it's not getting pregnant that increases that risk. So using drugs to increase your chances of having a healthy baby actually protects you against cancer. And Laura now has actually a number of frozen embryos there in case she wants to try again. So she's all of those eggs went to another cause, actually.
You bet. Thank you,
Dr. Max.